Why are so many young people getting it now?
See, now it has become a matter of concern. Even the college students, we are getting more and more blood pressure getting noticeable. So, like some chest discomfort because of the high blood pressure, chest heaviness, there may be some blackouts in front of eye, there may be.
But all things are related to stress, I think.
Stress is a major factor in the current period.
Hey everyone, welcome back to Heart to Heart. This show where we bring real life heart talk closer to you. Now let me ask you this. When you hear high blood pressure, what is the first picture in your head? 50s and 60s, right? Well, guess what? That's changing and fast. More and more people in their 20s and 30s are being diagnosed with hypertension. So today we are going bust some myths, sports and warming sign, of course learn what we can actually do about it. And to guide us through, we have got Dr. Rahul Singhal, who's been working closely with young patients and helping them reverse yearly heart risk.
So, I am Dr. Rahul Singhal, Director, Interventional Cardiology and Cardiac Electrophysiology, Fortis Hospital, Jaipur. So, I run my clinic at in the name of Shri Radhe Cardiac Clinic at Rajapag from 6 to 8 in evening. So today, basically, we will be discussing about the problem of hypertension, which is significantly rising in our middle-aged population, even in the teenagers from age of 18 to 40. So kindly be with us. I think you will have lot of information from this podcast, and by following this podcast, whatever we will be discussing on this podcast, I think you will better understand the problem of hypertension and how we can treat this problem.
Doctor, thank you so much for joining us today. So, doctor, I have to ask BP is supposed to be an after 50 problem. Why are so many young people getting it now?
See, now it has become a matter of concern. Even the college students, we are getting more and more blood pressure getting noticeable. Initially, it used to be after the age of 50, 60, 70, but now even the young adults, which we say it from the age of 18 to 40, are now having the blood pressure.
College students, that's scary.
Yeah, true. It is very scary that college students are also having found to have high blood pressure, and it is definitely probably because of the unhealthy lifestyle in which we are living today. Lot of unhealthy lifestyle in form of lack of physical activity, sedentary lifestyle, smoking, alcohol, lot of work stress, whether it is at home or at job front, salary issues, then keeping up the promises, high workloads, lack of sleep. So all these basically are creating a problem, and more these college students are now having the high blood pressure, and therefore sometimes their blood pressure, when they come to us for some other reason, then only they are found to have high blood pressure, or suddenly they get some symptoms like blackouts, dizziness, then only they are found to have that, they first time know that they are having a high blood pressure.
They are fit, gym, Instagram ready. Can they still have BP?
Yes, absolutely true. Because apparent looking healthy is someone, but patient might be having, or someone might be having a disease from inside. So it is very difficult that someone who is looking healthy from the outside, he's going to Instagram on a regular basis, he's going to gym, but still he might be having high blood pressure.
Yeah.
So for that reason, we basically ask for proper screening depending on the risk factors. So it is absolutely true that despite having physically fit or going to Instagram, but it does not basically take away that he is not having high blood pressure.
Are there any little hints the body gives us?
Yeah, sure. Because as I told you earlier, that patient or person might be feeling healthy from outside, but his body is the best guide at the current moment what he is feeling. So there are very small signs basically are noticed by the person, but most of the time they overlook those symptoms. So, like some chest discomfort because of the high blood pressure, there may be some chest discomfort, chest heaviness. Secondly, there may be shortness of breath. There may be some blackouts in front of eyes. There may be some episodes of transient loss of consciousness, which we call as graying, or excessive sweating, anxiety. Then cold clammy feet means there is excessive sweating in the palms and in the soles of the foot. Then person might feel somewhat irritated. And so these are basically very few small telltale signs, signals that may suggest that something is not good, something is going wrong. So this should basically make them aware, make them alert. They should not overlook their symptoms. Even they are mild in nature in the early stages, but they may be progressive in nature. So once they are noticing these symptoms, and particularly when they are going it for a longer period of time, like for 2 days, 3 days, 7 days together, then definitely it's time to take a call and go to your nearest doctor, get yourself checked, and maybe there might not be a problem, but still you are in a safer side that we have gone through the doctor and everything was normal.
Doctor, the body pays the price.
Yeah, definitely body pays the price, because we all know that if we ignore our symptoms, then definitely it's our body, it will pay the price, because when whenever these symptoms become most severe in advanced form, and then you basically consult the doctor, then the disease has already advanced, and now it is basically come to that stage in which it will not cannot be cured sometimes with medications, and you have to suffer financially as well as emotionally and physically and from the family side. So definitely body pays the price.
Can you give us a real life story, something relatable?
See, there are many real life stories. If we talk of the younger population, suppose there is a software engineer. He is recently passed out from the IIT and has recently done the job, joined the job. He's just 29 years, and he's basically going to his work routinely. And but sometimes he feels basically dizzy, or sometimes he feels very tired. So still he is going, and when some medical camp is there in the hospital, so he suddenly found to have high blood pressure. So it is. It may be shocking in the initial stage, because he might say, like you have said earlier, that apparently the person may look like healthy. He is going to social media, he is going to gym and everywhere. But suddenly, when somebody tells him that you are having a high blood pressure, so it is unimaginable at a particular time. But when we go on to the detailed history of such person who was having some minor symptoms and found to have high blood pressure, so everything which I have said to you earlier, like lack of physical activity, lot of stress, um, eating habits are very irregular, lot of junk foods, because he is in that profile where he cannot be punctual in his lunch or dinner time, and apart from that, like lot of basically coffee, irregular time of coffee, tea, and lack of sleep. So if we basically combine all these together, then these are the enough risk factors to have his blood pressure on a higher side. And therefore, such person require not only counseling with regard to lifestyle modification, but also with regard to medical intervention at the moment. He might be having other problems like high cholesterol, or his sugar content may also be in a pre-diabetic range. So he should undergo some test also, so that we can able to address all his problems.
Okay, so how can we aware?
See, awareness comes in, as I've told you, it comes in from within yourself. So there are some risk factors which person should know, like his parents, like his grandparents might be having some problem related to high blood pressure, related to diabetes, related to heart problem. So we have decided basically divided these risk factors into two categories. First is the non-modifiable risk factors. Non-modifiable means those which cannot be changed.
Okay.
Like, for example, age. We all know that as the age advances, we develop many diseases which we do not see in the young age. Similarly, males normally have more predilection to high blood pressure as compared to females. Then third is the race. Like South Asians, they are more prone to develop hypertension as compared to Americans or Europeans. So these are the some non-modifiable risk factors. So this is also very important because person should know that his family is having high blood pressure. So now he should take extra care for himself because he is running something in his family, whether it is a hypertension, whether it is diabetes. Then another set of risk factors comes in which we call it the modifiable risk factors. So modifiable risk factors means those which are in our hands and which we can modify to the greater extent and which we are not basically ready to modify. For example, blood pressure, then diabetes, then overweight, obesity, and lack of physical activity, sedentary lifestyle, lack of sleep, stress, smoking, alcohol. So these are a number of risk factors which are modifiable. So if we are able to have a means self-awareness of these risk factors, which I have categorized into two categories, modifiable and non-modifiable. These will make you aware. Okay, so suppose I am having a family history of hypertension, and I am diabetic, or I am obese, or I am having lack of physical activity. That means I have got two risk factors. So this make me aware that now I should be more vigilant when I get some symptoms, and it's a time to go to the doctor and get yourself checked.
But all things are related to stress, I think.
See, in the current time, you are right. Stress is a major factor in the current period in creating this high blood pressure, especially in the young adults, which we are discussing in the present time, between 18 to 40, because now we are living in a competitive era. So there is a lot of competition around. We see from small children, from fifth class, sixth class onwards, they land up in very tough competition, and this competition to me looks like a pseudo competition. We are not basically having a healthy competition, that we should basically make a group of good students and then do collectively the study so that everybody shines. But now basically it's a pseudo competition in the sense that we try to basically take a mile ahead from the other one, whether it will be your best friend. So that kind of a competition creates definitely a sense of stress. And this stress, then we know that whenever we are in this stress, there is a lot of stress hormones which are released from the body, which we call as the catecholamines, cortisols. And these basically then create an increase in the heart rate, increase in the high blood pressure, and over a time when this initially stress begins with a transient distress, but over a time if we are not able to address the situation, then it converts into the chronic stress, and then this chronic stress is then becomes the major cause of not only the high blood pressure but diabetes also, because in the present time we are also having stress induced diabetes. Means the person who might not be having diabetes at the outset, or he might not be having family history of high diabetes, but because of the chronic stress now he'll end up in diabetes. So then there is a bunch of medical problems then they start having. So definitely in the present time, besides these conventional risk factors like blood pressure, diabetes, stress is now becoming the most important risk factor. And it is also now becoming the most important risk factor not only for blood pressure but also for sudden cardiac death in young adults.
Chronic stress.
Chronic stress, as I have told you, that initially anything starts with basically for a moment,
Okay.
Like we got stressed when we are not able to secure first position. We come second and we are comparing
Right.
ourselves from our friend who has come first. So
Okay.
these are the very small things. We at home, we are basically having a competition with our brother, with our sister.
Yeah.
He has got the first position. I could not get. My parents had given this gift, and I have not got. So this these are the small things which create a sort of stress in the initial moment. But these are the transient one. But when these smaller things are not addressed over a period of time, then there is a persistently elevated catecholamines in our blood system.
Okay.
It was transient, it was episodic, that during that particular time it got high and then it basically come down to the normal level. But chronic stress means that now whenever you will check uh, his blood levels of cortisol, they are always found to be elevated. So that means that person is under the chronic stress, means throughout the stress and every time he is in stress. So whether he goes to his office, at that time he is also in distress and therefore he is not very happy with his work. He is irritable all around. He is basically shouting at everybody. He is not having his work properly. Then when he comes back to home, he is not eating properly. He is not sleeping properly. He is indulging in substance abuse like smoking, alcohol. So basically, all this chronic stress then ultimately leads to these problems.
Doctor, I don't eat oily food. I am safe with this. See,
See, oily food is one of the risk factors, as I've said. There may be so many other risk factors. Definitely, it's a very good that if you're not eating oily foods, because it is one of the risk factors for blood pressure. And if you're not eating it, then definitely it's a good sign. But it is only the one of the risk factor. It is not the total risk factor. So it will not take away basically the risk of having high blood pressure. So you have to look on the other risk factors as well, which can cause high blood pressure.
So even that innocent packet of chips.
See, that is a very important question because in this population, 18 to 40, lot of fast foods, including these wafers, chips, and junk food, pasta, pizzas. So these all are basically very high salty foods. Blood pressure control, salt is the biggest enemy for the blood pressure. So salt intake should be restricted. I'm not saying that salt should be totally avoided because salt is required by the body. So salt is only that amount which is permissible, which you are able to basically are using in the cooking, which you are able to cook, but not the added salts. So the salt part basically comes from the added salt. So added salt means like pickles, chutneys, and all these wafers, French fries, and chips. They all contain enormous amount of extra salt, and therefore these are not a very healthy snacks, and therefore should be avoided because they are not oily, but they are containing lot of salt. Both are the risk factor for high blood pressure.
And what about your work from home lifestyle?
Work from home again lifestyle. It was started in COVID. Earlier, there was not such a concept of work from home, but definitely during the COVID, it was a very wonderful idea of work from home. But over a period of time, now mostly the work from home is also getting one of the most risk factor for hypertension or any other form of disease because when you are not moving around, you are just in home. So that means you have curtailed your physical activity, and this physical activity is also a very important play a role in high blood pressure. So if you are living a very sedentary lifestyle, because work from home means you are not doing any amount of physical or stretching your muscles or so. You are just sitting idly on the chair in front of the computer, or you are on the bed or in front of the computer. So you are not at all doing the physical activity, and some sort of physical activity is required. Whenever you go to the office, then it requires some sort of physical activity. You will be walking, you will be running, you will be going through stairs, and then in office also you will be roaming around from desk to desk. But this is not basically occurring when you are at home and doing work from there. So definitely this is also one of the risk factor in the current time for high blood pressure.
So what is the fix?
Fix is basically the lifestyle, in particular like office there is a set routine. Like I'm going to the hospital, so there is set routine that I wake up at 5 o'clock or 6 o'clock and then do whatever like yoga and some exercises. Then I have my basically breakfast, and then by 9 o'clock I reach hospital, and then after completing my work from the hospital I am back at my clinic 6 o'clock. So it is basically a fixed routine which everybody is basically doing. Like somebody is doing software engineer, he is going to the office from 9 to 5, he might be having his job, at 1 o'clock he might be having lunch. So there is a fixed routine. But when you are doing work from home, that routine is not entirely not there. Sometimes you are munching something, then you are
Yeah.
so all these then creates a habit acquiring in form of salt intake, high basically oil intake, and coupled with lack of physical activity. So
Okay.
ultimately leads
Yeah.
to all these problems.
Okay, now doctor, I have to bring this up. जैसे लोग parties करते हैं या smoke, ये problem ऐड कर सकता है?
Definitely, पहले भी मैंने आपको बताया कि smoking is one of the risk factors,
Yeah.
and particularly in the current lifestyle in which we are living, uh, smoking is now becoming more and more even a fad basically in young population. 18 to 40, even the college students, they are found to have
Yeah.
smoking to a greater extent. So similarly, partying around social media, so in which we cultivate lot of bad habits, in which smoking is one of the risk factor. Then secondly, maybe it starts from some minor amount of drinking, and then
Yeah.
gradually it increases. Then there may be in some circumstances substance abuse, like drugs also. So all these become rampant, particularly in teenage parties. So that is to be looked for and to be avoided, so that we don't end up in these problems.
But young people तो ऐसे बोलते हैं कि occasionally पीने से या
There is no
Yeah.
there is no such thing occasionally,
Yeah.
because I always basically educate my patients that sometimes they also they also say that पहले मैं 20 cigarette पीता था, now I am shortened my cigarettes and it has come down to 10 or 5. So risk factors remains the same. Whatever the studies have been done, they have shown that whether you smoke 1 or whether you smoke 10 or whether you smoke 20 cigarettes in a day, they carry the same risk factors. And you will be surprised to know that even the passive smokers, suppose somebody is smoking and another one is sitting just beside him and he is not smoking, so he is a passive smoker, he is also having the same risk as he is smoking.
Yeah.
So you can understand that even the one cigarette, not even the person who is smoking at all, he is also having the same risk factors.
Yeah, also
So
I feel.
yeah, so that is the basically not a matter of occasionally drinking, smoking. These are all not the basically meant for occasionally. They are definitely going to harm in any way, whether you smoke on a regular basis, whether you take a drink on a regular basis, or you take it occasionally.
So basically, add it to the routine health checklist.
Yeah, there should be a checklist. So first thing is very important that I have told you earlier also, that first identify your risk factors and categorize them into modifiable and non-modifiable risk factors. Then second thing is basically be alert for your symptoms, whether they may be it may be mild, it may be moderate, it may be severe, but and at any moment of time do not overlook your symptoms. In particularly if you are having one or more than one risk factors. Third, then you should basically once you are having knowledge of your risk factor, once you are having knowledge of the symptoms, then third important thing is to execute. Because now this has been already thought, process has already been developed. Now it is a time to act. And act, how you can do, you can basically go to the doctor. Do not basically chat GPT or
Yeah.
AI, or do not basically go on the Instagram or the Facebook to find the solutions, because this is also getting more and more in the common in the present time. So directly consult your doctor. Don't hesitate to share your symptoms, your problem with the doctor. Most of the time, I as a doctor basically try to reassure the patient in the early stages, not to give him any medication, just on the lifestyle modifications. Then doctor will fourth thing is the diagnostic part, in which he will ask you to for certain tests to be done so that we can rule out some problems, and these can start from basic investigations from, and then ECG, echo, and so these are basically the checklist, basically the risk factors, then your symptoms, and then time to act with regard to investigations, what your doctor says, and take the medication regularly.
So, doctor, what about phone and screen time? Because also I feel guilty.
So this
So,
is also very important question. Screen time, is now another important risk factors, which is a killer in the present moment. Basically, the guidelines, or the cardiology guidelines says that you should not spend more than 1 or 1.5 hours uh, on the screen, because more is the screen time. Not only it is affecting your entire body, it is not just only the blood pressure, it is affecting your eyes, it is affecting your brain, because it depends upon what content you are seeing on the basically the screen, whether it is TV, whether it is social media, your phone. So, and it also takes away your comfort of the sleep, the quality of the sleep, the quantity of the sleep, because more you spend time on the screen, your sleep quality as well as the quantity,
yeah.
both gets reduced. So therefore, try to limit your screen time so that you have a better healthy lifestyle.
If someone just been diagnosed, what is the first move?
See, I've given you a real story. So that is basically that if somebody for the first time is found to have high blood pressure, so the first important thing is that first he should go to the doctor. Second important thing is that the doctor will take a deep dive in the history. It will try to take out what are the causative factors which are causing this high blood pressure. It may be just an incidental finding.
Yeah.
Normally, blood pressure basically which we take is not the instant blood pressure. Suppose you come to my clinic and you found to have a high blood pressure, means 150, 90. So I will not take it as your that this reading is a high blood pressure. So I will try, or I will advise you basically to take the blood pressure for 3 consecutive days on the same time, and the average of those 3 readings will decide whether you are having high blood pressure or not. So single day blood pressure do not basically denotes anything. So you should not, first thing is you should not panic about that. Sometimes your blood pressure is high and you become panicked. Oh, I am having a high blood pressure. So it should be the average of 3 blood pressure reading. Then only we can qualify it as a high blood pressure. So once you are having qualified high blood pressure, then definitely it's a time to deep dive into the history. What are the factors which are causing this high blood pressure? And in the young population, particularly in the middle aged, which we are talking about, they are large number of factors which are curable, because I have not told you earlier that there are 2 types of the blood pressure: essential hypertension and secondary hypertension. Essential means which is the blood pressure which usually is seen in the elderly population after 50 years of age or after 40 years of age. So in this 90% do not have any cause for the high blood pressure. It is just by incident they are found to have high blood pressure. On the other hand, if we see the young population, that mostly these patients are having secondary hypertension. Secondary means it is secondary to some factors,
Yeah.
like he might be having some electrolyte abnormality, he might be having some renal artery stenosis. So there may be various other factors. So if we are able to take a good history and then we are able to diagnose that this is the cause of high blood pressure. So maybe he might not require to take the blood pressure medication for lifelong. Once you are able to cure the cause, then the blood pressure is also gone. So that is the difference between the young population hypertension and the adult hypertension. That these group will have lot amount of secondary cause of hypertension which you need to identify and treat.
What else?
See, after lifestyle, if suppose lifestyle definitely should be the first line of therapy because nobody wants to take medication for lifelong.
Yeah.
So there are many instances in which lifestyle alone will not be helpful. So in that, then there, of course, the medications play a very important role. We have got n number of good medications which are basically being given to the patients to control the blood pressure. So to start with, it may be one medication or two medication, and then depending on the response, we may increase the dose, we may increase the number of medications. And so then third important thing in the management is now in the upcoming time is renal denervation. Renal denervation is the one in which, as I told you, the kidneys are the biggest cause of the high blood pressure. There may be some disease harboring in our kidneys. So we are able to basically do the ablation of sensory nerve endings in the kidney artery, renal artery, which we call this. That is called the renal denervation. So that also takes care of the high blood pressure. So we have got lifestyle modification, and second important thing is the basically medications. And after these two, if we are not able to control the blood pressure, then we have got now these newer innovative approaches like the renal denervation therapy.
Okay. So medicine is not the destination,
Yeah,
just a step on the journey.
yeah. See, first important thing is that do not basically shirk away to take the medication, even if they are to be taken for lifelong.
Yeah.
Because most of the time when the person comes to us with high blood pressure, so they always say, oh, अब तो हमें दवा lifelong खानी पड़ेगी.
Exactly.
So that should not be the idea because we always talk in risk benefit ratio. We are not basically talking just absolutely that you have to take the medication and it has to be for lifelong or not lifelong. But it has to be basically seen in perspective of risk benefit ratio. Means what is the risk benefit ratio? That suppose for a medication, if the benefit is more than the risk, then you have to take it.
Yeah.
Whether you have to take it for short time or you have to take it for a longer period of time or lifelong. If the risk is more than the benefit, then definitely for some time you may take and then you can discontinue the medication. So this is very important that bear in your mind that if the doctor prescribes you the medication, do not basically take the medication on an irregular basis just from having an idea that if we start the medication then we have to take it for lifelong. There are some examples in which we have stopped the medications altogether for the hypertension.
Okay.
But one thing, only the drug is not enough. The lifestyle modification is also enough. Because there's many examples in which person continue to take the medications, but they are not following the lifestyle.
Yeah.
Means they are taking high amount of salt, they are taking high oil consumption, they are consuming a lot of oily foods, a lot of partying around, smoking, alcohol.
Yeah.
So how they will have their blood pressure control, and then they want that these medication need to be stopped.
Yeah.
So that is not possible. That is only possible if above the medication you are having the lifestyle modifications.
Okay. So, doctor, what is your one-line message for young adults and for me?
See, passage is crystal clear that hypertension is a growing problem in a younger age.
Yeah.
So, and we have discussed about it, how much basically it is creating a problem. It is a very important risk factor for cardiac disease. It is very important risk factor for paralysis. So one line basically is move, meal, manage and monitor. Means 4M you should basically remember. Move means good amount of physical activity. Meal means judge your diet. It should be balanced diet, healthy diet. Manage means manage your blood pressure based on your doctor's advice.
Yeah.
Do not try to treat yourself own. And monitor means after even you are having all these three M's, the fourth M is also important. Keep on monitoring your blood pressure. So you might be having high blood pressure at some instant, even on medication, even on lifestyle modification. So it is a basically a continuous journey. So my basically uh, last message basically is the bottom line is move, manage, monitor, and basically take good care of your meals so that only we can control the blood pressure.
Thank you so much, doctor, for joining today Heart to Heart podcast.
Thank you so much. I hope my viewers of this podcast will have a greater knowledge of the hypertension and will benefit to the most. Thank you so much.